Hello everyone. Today, we're diving into the world of a medication called Terazosin, commonly known by its brand name, Hytrin. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Terazosin, known by the brand name Hytrin, is an oral medication that belongs to a class of drugs called alpha blockers. It works by relaxing the muscles in the prostate and bladder neck, making it easier to urinate. Terazosin is primarily prescribed to treat high blood pressure, hypertension, and benign prostatic hyperplasia, BPH, which is an enlarged prostate. The FDA initially approved Terazosin in 1987 for the treatment of hypertension, and it was later approved for the treatment of BPH. When used to manage high blood pressure, Terazosin helps to relax the blood vessels, allowing blood to flow more easily and lowering overall blood pressure. This can help prevent strokes, heart attacks, and kidney problems. For patients with BPH, Terazosin helps to alleviate symptoms such as difficulty in starting the flow of urine, weak stream, and the need to urinate frequently or urgently. Warnings: Terazosin comes with its set of precautions. It may cause a sudden drop in blood pressure, especially after the first dose or when restarting the medication. This can lead to dizziness, fainting, or lightheadedness, particularly when rising too quickly from a sitting or lying position. It's important to take the first dose at bedtime and follow your doctor's instructions carefully to minimize these risks. Before taking Terazosin, it's crucial to inform your healthcare provider if you have a history of low blood pressure, kidney disease, liver disease, or prostate cancer. It's not recommended for those with known hypersensitivity to the drug or any of its components. Before taking this medicine. Before starting Terazosin, several factors need consideration. Ensure your healthcare provider is aware of any allergies you have, including allergies to other medications. It's also important to discuss any other medical conditions, particularly heart problems, as Terazosin can affect heart rate and rhythm. If you are pregnant, planning to become pregnant, or breastfeeding, consult your healthcare provider before starting this medication. Although Terazosin is primarily used in men, women with hypertension may be prescribed this drug, and it's important to understand any potential risks. Inform your doctor if you have a history of heart problems, liver problems, kidney disease, or if you are scheduled for cataract surgery, as Terazosin can cause complications during the procedure. Side effects: all medications can have side effects, and Terazosin is no exception. Common side effects include dizziness, drowsiness, headache, and nasal congestion. These are typically mild and often diminish as your body adjusts to the medication. Serious side effects can include a significant drop in blood pressure, leading to fainting, a rapid or irregular heartbeat, and symptoms of an allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any severe or unusual symptoms, seek medical attention immediately. Additionally, there is a rare but serious condition called priapism, a prolonged and painful erection, which requires immediate medical intervention to prevent long-term damage. Interactions: Terazosin can interact with other medications, so it's essential to inform your doctor about all prescription and over-the-counter drugs, supplements, and herbal products you are taking. Interactions can occur with other blood pressure medications, erectile dysfunction drugs, and certain antidepressants, among others. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Terazosin. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. For hypertension, the typical starting dose is 1 mg at bedtime, which can be gradually increased based on your response to the medication. For BPH, the starting dose is also 1 mg at bedtime, with potential gradual increases. It's important to take Terazosin at the same time each day and follow your healthcare provider's instructions precisely. Avoid: while on Terazosin, it's advisable to avoid activities that require alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Alcohol can enhance certain side effects, such as dizziness, so it should be consumed with caution. FAQ: many wonder about the age restrictions for Terazosin. While it's primarily used in adult men for BPH, it can be prescribed to both men and women for hypertension. The safety and effectiveness in children have not been established, so it's best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Terazosin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.